Palm Beach, Dade, and Broward counties for the last 25 years. The practice of medicine is changing dramatically. All County Healthcare, Inc. still does it the old-fashioned way, where our nurses and healthcare professionals come into your home to service your medical needs, providing you the fastest and best care possible. For more information, call 954-717-7027. And remember, Medicare Home Care is covered by Part A of Medicare with no out-of-pocket cost to you. It's your decision, and only your decision, on what healthcare agency you use. Call today. All County Home Health Care, Inc. at 954-717-7027. License 200999096. The opinions expressed on the following sponsored program are strictly those of the host, guests, and callers, and not necessarily those of this station, its staff, management, or sponsors. Amp2.tv presents You and Your Doctor, teaching you to live a longer and healthier life. Proudly sponsored by All County Healthcare, where people are the heart of our business. All County Healthcare is a Medicare certified agency where one call will service all your home care health needs. For more information, call 954-717-7027 or visit our website, allcountyhealthcare.com. Now, let's get informed to living a longer and healthier life. Here is your host for today's show.
Hello, South Florida and beyond, and welcome to the You and Your Doctor Living a Longer and Healthier Life show. We're going to welcome back to the program this evening Dr. Darin Bush. He's trained in family medicine, but focuses more on mobility, spine, and sports, and keeping people moving in different directions through this quality of life that we enjoy here in South Florida. So I'm going to get right into it. He's in Fort Lauderdale. You recognize him. He's been on the program 4 times. Dr. Darin Bush, welcome to the program. How are you doing this evening?
Very well, thank you, David.
Thank you for joining us on this adventure of health. I always say that. And you're right there in Fort Lauderdale. I'll give out the info. But wanted to have you on. You're doing some new things in your office, which can definitely help out for men's health. So let's get right into it. Erectile dysfunction. I mean, see the commercials, hear about it as you age or different reasons. But what actually is it? And why do men get it?
So erectile dysfunction is something you see in your 30s. 30% of men have some sort of erectile dysfunction. In your 40s, 40% of men have some sort of erectile dysfunction. 50%, and 70, as many as 70% of men have some sort of erectile dysfunction. And erectile dysfunction is not complete impotence or the inability to get an erection, but it's some sort of difficulties with sexual performance. And it can be caused by many, many reasons. It can be caused from people who have cardiovascular diseases, people who have high cholesterol, people who are depressed. It can also be a side effect from a lot of medications that people have. But in a lot of men who don't have any of those things, it's just a matter of the aging process. So the artery that goes into the penis is about 1/4 the diameter of the coronary arteries, which feed the heart. So they're very, very, very small. And as you know, as we get older, we develop sludge in our arteries and in our veins. And so if you've got an already small artery, and as we age, it starts getting more narrow and narrow as we get older with sludge building up in it, it becomes more difficult to get an erection. So we focus on getting rid of the sludge and increasing the vascular and the arterial supply to the penis and getting stronger erections.
Opening up the blood flow.
Opening it up.
That's great. And it's Dr. Darin Bush. He's trained in family medicine. So you talk to us a little bit about the causes, and I immediately thought, I would have never thought that diseases, depression, medications, artery, I just kind of thought it was something that happens over time. Are men surprised when they hear that maybe it could be from depression or cardiovascular disease or different reasons?
The problem with a lot of men is that, a man's penile health or their sexual stamina or their sexual performance is so important to them, but so few men are actually willing to talk about it. So men who go to their doctor wanting to ask about sexual performance or about the inability to get an erection or not as strong of an erection, they go to the doctor for that reason, but they will walk out of there without ever actually asking the questions. So many men don't know what's causing it, and until that conversation is started with their doctor, they're not aware of it. But many medications, whether you're on antihypertensives, if you're on antidepressants, that type of thing, that can cause it. And also if you're just very stressed out at work, just the psychosomatic, you're in your head all the time and the blood's not going to the right head, if you will.
Yeah.
So you're not getting the erection. So it's a conversation that needs to be started with men, with their doctors.
And that's a good point too. I mean, anyone who's taken medications definitely should be, seeing a doctor, talking to someone about what they're on, maybe, talking to if they have other issues, like you go to a sleep doctor because you may have sleep apnea or suspects. So you go to family medicine, you talk about, a little bit about your health, well, a lot about your health, but what kind of medications you're on, or if you need help with erectile dysfunction. That's, questions that I think men kind of get in a hurry when they get in that position and don't really think it out. I've been going to the doctor more in my 40s now, so I write everything out. And I have because when I get in there, I'll tell you what, when I'm with the doctor, I completely just...
Blind.
Yeah. If I don't have something written down...
Yeah.
But I would never thought of that. That's a great point that you made. Dr. Darin Bush is with us. Now, I got from your website, Mobility, Spine, and Sports, and we're going to talk a little bit later about why that is named that way. But mobility is good right there because it goes along with what we're saying. But
Absolutely.
What I'm getting to is there's some options you do right in the office, which I thought was really neat. Tell us about the three main ways you're treating it. It's testosterone replacement therapy, bioidentical hormone replacements, and this sounds really interesting, shockwave therapy.
Yeah. So any patient that comes in, any man who's in their 40s really should have their hormone levels evaluated. Because, again, once we get into our 30s, things start changing. And I always say they change by the decade. 30s and 40s and 50s, every decade is a little different. And our testosterone levels start dropping by about 30% per decade, starting in our 30s. So every man should have basic hormone levels drawn. Estrogen levels to make sure your testosterone is not converting into estrogen. See what your testosterone is, what your bioavailable testosterone is. If you're deficient in those things, erections are going to be difficult as well. So if you are deficient, or if you're what I call suboptimal in any of your hormone levels, then we'll replace your hormones, get them to an optimal level. So if you have the proper hormones and then things aren't working, then there's other things that we can do. The newest thing that we've started doing in our practice is it's a protocol called Gainswave, and it's using shock waves or sound waves to essentially blast the arterial and the musculature inside of the penis with acoustic waves. It's painless. It takes about 20 minutes, and what it does is it causes sort of what's called cavitation, or it causes little micro trauma to happen in the penis, which stimulates the brain to think that there's trauma to the penis. So it sends in all these new inflammatory cells that starts creating new vasculature. If you can get new vasculature inside of the penis or inside the muscle, new vasculature, new arterial, you get new muscle growth, new tissue growth, you get stronger erections.
Different pathways for that blood to flow.
It's called collateral blood flow.
Wow.
So if you have vasculature which it doesn't have the ability to open up, by using Gainswave or by using the shockwave therapy, you're causing small micro trauma in there. The body automatically starts creating new arterioles, which is a new pathway for the blood to flow, which means stronger, harder erections. And for people that don't necessarily have erectile dysfunction, but they just don't last as long as they want to, or they don't get as much sensation from that, that's also a way for them to improve their performance.
Great point. We're here with Dr. Darin Bush. If you have any questions about ED, number's 1-888-565-1470. We're here until almost 6:30 p.m., but I'll give out his info a few times tonight. It's mobilityspineandsports.com is where you can find most of the info as well. So those three options in your office, so the testosterone replacement therapy, the bioidentical hormone replacement, shockwave therapy. Let's start again with shockwave therapy. How long does that treatment take, and how often would a person need it?
So when you first come in, we put a numbing cream on you, so it numbs everything up, and that takes about 30 minutes for the numbing cream to set. But the procedure itself takes about 20 minutes. It's fairly painless. It's not very uncomfortable. And generally, in the first month that you have the treatment, we recommend 6 treatments in the first month, or 2 treatments per week for 3 weeks. And then it's maintenance after that. Now, if somebody has a lot of underlying health conditions like diabetes or heart conditions or cardiovascular disease, then we may recommend 12 treatments, which would be spread out over the course of 2 months. But for the first month, we recommend probably 6 treatments. two done a week throughout the month. And then after that, it's just a maintenance program. In a young male who's 30 or 40 who has no comorbidities or no hypertension or problems like that, then we do the 6 treatments in the first month, and then maybe they come in once every 6 months for a touch-up. Somebody who's a little bit older, then we may have to do the full 12 treatments, and then they may come in every 3 months for a touch-up.
And this, is someone who doesn't have comorbidities, like you said, this could just be the anatomy and the way everything's set up. This could help open up some pathways, like you said.
Yep.
Wow, amazing. This is amazing stuff. Dr. Darin Bush, Family Medicine, Mobility, Spine, and Sports, mobilityspineandsports.com, 954-414-7080. He's located in the iconic round building there, 3101 North Federal Highway, Suite 201 in Fort Lauderdale, right there on the corner. You can't miss it. I know you've all seen that building. Every time I go by it, I think of you. That's where he is. I got to stop by and say hello sometime.
That's for sure.
It really does. You've been almost there, almost 2 decades here in South Florida.
I've been in South Florida since 2003. And I've had the Mobility, Spine, and Sports in the iconic round building location for about 3.5 years. But I've been in the Fort Lauderdale area for almost 20 years.
Nice. That's a great location, great area. One more thing about the shockwave therapy. Do you think out of the 3 that you offer for this kind of treatment of erectile dysfunction, that's most effective?
I do. There's always prescription medications. There's Cialis and Levitra and Viagra, which they work to open up the vasculature. And when we do the therapy, we do put somebody on something like Cialis so that it opens up the vasculature a little bit better. But the EPAT is sort of the only thing that actually is out there that actually works inside the penis to strengthen it and to increase the vascular flow. So that in conjunction with testosterone replacement, I think it's a great marriage. That
is great. Again, Dr. Darin Bush. So if someone may think they may have some hormonal issues, I mean, I know with men, I mean, that around 40, I mean, at 30, you were even saying things really change.
Yes.
Starting with metabolism, I mean, you can't burn as much as you were. Can they come see you about that as well to kind of see what kind of numbers they have and have a DO, a doctor of osteopathic medicine, look at it?
Absolutely. A lot of times guys don't know that their hormones are declining, but they'll notice that they're a lot more tired after the gym, or they don't want to go to the gym, or they don't recover as well from the workouts after they go to the gym, or they're noticing that they're not sleeping as well, or they're having a more difficult time losing weight, or they're not dealing with the stress as much. Those are all signs of hormone deficiency or decline in hormones. So anybody who's above the age of 30, or even younger if you're having those symptoms, should get their labs drawn just to see where you're at, if not just for a baseline, so when you get to be 40 or 50, you know where you're coming from.
Yeah, you have to have that report, to give a doctor to see how it works. Again, we're here with Dr. Darin Bush, Family Medicine, Mobility, Spine, and Sports, mobilityspineandsports.com, 954-414-7080, located in Fort Lauderdale. One more question, we'll take a quick break. Do you take insurance for the ED treatments?
So for the hormone levels, that is covered by insurance. And sometimes if you go on a medication like Cialis or Viagra, that's covered by some plans. Unfortunately, a lot of insurance companies are not covering preventative health for men. So it's not always covered, but the labs would be covered. As far as doing the Gainswave or the shockwave therapy, that it's a cash basis.
Okay.
Yeah, no insurance for that.
That's something someone can plan upon.
Yep.
And just having that information. Again, mobilityspineandsports.com, there's a ton of info. Let's take a quick break and flip the talk from ED, erectile dysfunction, to integrated approaches that you have there at Mobility, Spine, and Sports.
Excellent.
All County Healthcare has exciting news for any and all patients with COPD or other respiratory ailments. Listen to what renowned pulmonologist Dr. Keith Robinson has to say.
Hello, I'm Dr. Keith Robinson, board-certified pulmonologist, medical director at Fusion Health Pulmonary Rehabilitation, and a board member with the American Lung Association of South Florida. We have exciting news for patients with COPD. We now offer IPV therapy at home, which has been demonstrated to improve airway clearance, decrease hospitalization, and improve quality of life of patients with COPD. Please call All County Healthcare for more information about this FDA-approved therapy.
For further information, call All County Healthcare now at 954-717-7027. That is 954-717-7027. Or visit our website at allcountyhealthcare.com. You can also find us on Facebook, YouTube, Twitter, Instagram, and LinkedIn. Remember, All County Healthcare always puts the patient's needs first. All County Healthcare always puts the patient's needs first. You are listening to You and Your Doctor, Living Longer and Healthier, an informative show that helps you find answers to questions you always wanted to ask but did not have that somebody that could make a difference in your life. Call into the show if you have a question at 888-565-1470, and we will put you on the air to inform all our listeners. Now, back to our show.
Hello, South Florida and beyond, and welcome back to the You and Your Doctor Living a Longer and Healthier Life show. We're here with Dr. Darin Bush. He's a DO, Doctor of Osteopathic Medicine. We talked a lot about DO versus MD last time, but I want to get into this evening about your integrated approach. I saw a very neat thing on the website, mobilityspineandsports.com, your website, of the integrated approach and some concepts you have: rebuilding a youthful glow, sleeping a better night, increasing your sex drive, managing pain, losing weight faster, increasing energy. These are what adults are talking about.
Yes.
And you're the guy who can help them out.
Yeah, like we discussed in the previous segment about doing hormone levels. A lot of times, if you go to traditional physicians, they'll do basic blood work, but they miss out. They miss a lot of things. They don't look at the different subsets of thyroid dysfunction, and they don't look at all the different testosterone levels. Or they'll see that you're, like, if you look at testosterone, for total testosterone, the range could be from 200 to 990. If you're 206, your doctor thinks you're okay. But when we were 20, we were up around 900. So when we look at you and we evaluate you, we look at what's called optimal blood work, which we want you to be in the upper 1/3 of normal, so that you're performing the way you always want to perform. As men, as we get older, our mind continues to be a 20-year-old mind, but our bodies don't keep up with that. So we want to keep our labs at the level that we were when we were in our 20s. So if you can have that stuff, if you can have your hormones and all of your blood work within optimal ranges, and your cholesterol well maintained, and your thyroid well maintained, then you can have better sleep, and you can have better skin, and better social outings and workouts and all of those things. So it really, in my practice, we really focus on what's going on inside and what can we do endogenously, or from the inside, or exogenously, which is from the outside, which is using vitamin supplements or exercise regimens or whatever to give you sort of the optimal health that your body can achieve.
And when you're in optimal health, you're happier, and that's going to stave off depression, because I think, depression levels are very high in this country. We got a lot going on, each and every one of us, and sometimes it can be overwhelming. But if you have, a good night's sleep, if you're having better sex, if your pain's being managed, and that's a big thing.
Huge.
People get into pain, and they just sometimes it seems like there's no way out.
Especially right now with the whole quote-unquote opioid epidemic, and there's so much stuff all over the news that people are almost afraid to go to their doctor and talk about pain, because they don't want to be prejudged that the doctor may think, or the pharmacist may think, that they're looking for a pain medication. Pain medications are sometimes necessary, and just like diabetics, some diabetics need insulin, some diabetics don't need insulin. Some people who have pain need pain medication, others don't. And there are integrative approaches to dealing with pain, such as exercise and lifestyle modification, a lot of injection work, osteopathic manipulation, physical therapies, biofeedback. There's so much available to treat pain other than pain medications. But it has to start with you being available to ask that question to your physician, and being comfortable enough to ask your physician for that.
And having a physician who will take the time to, figure this all out. Yeah. You're like super specialized primary care, but like super specialized. I don't mean that in a derogatory way.
Right.
It's like going to a primary care doctor, but getting like all the things you really wanted to get.
Yeah. And I always tell people, I'm a person first. I'm a human first. But I happen to be a doctor. So I'm a person first, and you can talk to me like you would talk to a person. And I'm going to talk to you like I would talk to a person. I've got the medical background, and I'm interested in every facet of medicine, especially the facets that make you feel good, and so that we can live a better life. It is a tough life, and there's a lot of depression, and there's a lot of stuff on the news. People really should just shut the TV off every once in a while. They'd feel better.
I did that recently.
It helps, right? Just unplug,
awesome.
Put your phone on vibrate, shut the TV off, and just breathe a little bit. So it helps me being a personal physician, that I'm open. You can talk to me about whatever, and if I don't know about it, I'll learn about it so that I can share it with you and also with the next person that comes through the door.
Yeah, you have a passion for what you do. It comes out in the way you speak. Again, Dr. Darin Bush, mobilityspineandsports.com, 954-414-7080, located 3101 North Federal Highway, Suite 201, Fort Lauderdale. And I was going to say before, that's on the corner of Oakland Park Boulevard and Federal Highway. I believe that is the northwest corner. Yep, that iconic circular building.
Yes.
8-story building right there. So I mentioned family medicine a few times, and then I didn't, because I want to kind of ask you a question. So you're trained in family medicine, but when you were able to do some extra training in non-surgical orthopedics?
Yes. So as an osteopath, my background in medical school was we did a lot of hands-on. We learned how to do musculoskeletal medicine, and we learned how to do spinal manipulation. So that's part of my training. And then as I went through family practice and learned the medicine components of it, I always found myself going back towards the core of the body, or the spine, or the musculoskeletal system, and realizing that the root of a lot of things going on in our body comes, like I mentioned before, endogenously. It comes from what's going on with our hormones, or with our spine, or with our musculoskeletal system. And it just fit me as an athlete, as a person. It just fit who I was. So I've been able to, for the last 19 years, tailor my primary practice really into an interventional pain practice and a non-surgical orthopedic practice.
And that's going right into my next question. So you can help people out with pain management interventionally for arm, elbow, foot, ankle, general body, hand, wrist, neck, spine, hip, leg, and knee, and shoulder pains?
Yeah. I always tell people I treat from the top of the head to the tip of the toe. If it hurts or aches or breaks, I can work on it, and I can help you fix it.
Mm-hmm. And sometimes these are interventional procedures right in the office.
Yeah.
I mean, obviously, most of it is done right in the office. You're very office-based at this point.
So, I have therapists who work in the office who do craniosacral therapy and neuromuscular work and massage work, and we do physical therapy modalities. I do spinal manipulation. If you need injections, we do all kinds of injections in the office. I have a fluoroscope or a C-arm in the office, so I do live X-ray injections right in the office. So anything from basic trigger points to joint injections, to prolotherapy, to facets, epidurals, PRP, exosomes, stem cell stimulation, all that kind of stuff we do right in-house.
That's great to know. And the house is Mobility Spine and Sports, mobilityspineandsports.com, Federal Highway in Fort Lauderdale, 954-414-7080. And then also, which has come to the forefront last decade, or maybe before that, you're a doctor, you probably knew about it before then, Botox for pain.
Yes.
That's an option too.
Yeah. Well,
not just for the face. There's also, it can be used for pain.
Yeah. So I'm using Botox in the office, or in the medical community. We use Botox to treat cervical dystonia, which is hyperactive muscles of the neck and spine. We're using it for spasticity. Sometimes we use it for people with MS or people with other type of post-stroke issues. We use it to treat a lot of migraines. So it's used to treat a lot of things. I don't do this in my office, but it's also used for people with chronic hemorrhoids or those types of things. So it's really being used in all facets of medicine. I use it for the interventional pain, so for muscle spasm, for migraines, for dystonia, that type of thing. And we also, of course, in the office do Botox cosmetic. So if you come in with migraines and neck pain, you also go out looking a little more pretty.
Definitely. You're going to have that glow.
Yep.
You're going to look right. And going all the way back to hormone, I forgot to ask this. We got about 2 minutes. Okay. So the hormones can have a lot to do with weight loss.
Yes.
And men don't realize that. I mean, women don't either, but I know men. I don't never thought of hormones.
Yeah, the thing about it is as your testosterone levels drop, or as your growth hormone levels drop, the body does, it has to do something. So when you have lower testosterone, your metabolic rate goes down. If your metabolic rate goes down, your body, it gets rid of fat a lot. It gets rid of fat slower. You deposit more fat. You change, instead of taking the foods that you eat and turning it immediately into muscle, it turns it into adipose or into fat. You get lower energy. So that changes everything as well. So the hormones affect everything. And one thing that people miss the boat on is thyroid. If your thyroid's not functioning where it needs to function, it's going to change everything in your body, from your mood to your sleep to your hair texture to your skin texture to literally everything.
In men and women.
Men and women.
Great point.
And a lot of men, even if they have a lot of testosterone, sometimes the testosterone levels are pushed into estrogen, which can cause a lot of weight gain for men as well. So it's necessary to get all those things just checked out.
I see. Well, this has been a really great talk. Again, it's Dr. Darin Bush, mobilityspineandsports.com, 954-414-7080, 3101 North Federal Highway, Suite 201 in Fort Lauderdale. A great doctor, treats erectile dysfunction, ton of pain management and health options for men and women. So go check him out. Thanks for coming on the program.
Thanks for having me.
We got to get you back on for number 5 in the future, but that was an amazing talk.
Thank you very much.
We'll see you next time on the You and Your Doctor show.
Thank you for letting us share with you a longer and healthier lifestyle. If you have a doctor or are a doctor and wish to be on the show, call AMP2 TV at 866-244-5422, and we will put you on the air as soon as possible. Tune in next week for more information on living longer and having a healthier life.
The opinions expressed